Hi, welcome back to What's Up Doc. I'm Dr. Michael Cohen. I thought today that we would speak about the placebo effect. For those of you who've not heard of the placebo effect, a placebo is any substance or treatment which is designed to not really have any therapeutic value. It's not supposed to work, but somehow does. And the idea of a placebo is that your brain can convince your body that a treatment which has no physiological effect is actually a real treatment, whether it be a medication or whether it be a physical treatment. The Oxford Dictionary describes a placebo as a substance having a beneficial effect produced by a drug or a treatment which cannot be attributed to the properties of the placebo itself and must therefore be due to the patient's belief in that treatment. So, like I said earlier, it's not necessarily a drug. It could also be a physical treatment. It could even be someone just talking to you. A story comes to my mind quite recently when I had the mother of a close friend of mine who was not feeling well at home, and I went to check her out in the evening. I examined her, and I ended up taking a blood test from her because I actually thought I needed to rule out a more serious problem. I processed the blood. I found out the result. Everything was pretty much okay with her. And I hadn't given her any medication at all. But her response to this was to tell her son that finally something had actually worked, which was the injection that I'd given her. I hadn't given her an injection. So this is remarkable. She was in quite severe pain. And by the end of the evening, she was feeling dramatically better. There's a number of diseases where placebos have actually been shown very clearly to have a good effect. And these include depression, pain, fatigue, Parkinson's disease, irritable bowel syndrome, and even osteoarthritis of the knees. And I can say for sure from my own clinical experience that there's a lot more other illnesses in which placebos do work. The opposite of the placebo is something called the nocebo effect. So actually, if I was to give you a drug, which is not really a drug, and it's let's say a sugar pill, but I tell you that this has certain side effects such as headache and abdominal pains, and then you take this inert substance and you develop either a headache or abdominal pains or both, that's an example of this particular action, drug, treatment, tricking your brain to think that it's going to actually have negative effects, and the brain will actually send signals to the body whereby the body actually feels worse for taking it. A very important use of placebo is done, or should be being done, by most doctors all of the time. Every time a patient walks into my room, the aim of the consultation should be, apart from diagnosing them properly and treating them properly, that they should walk out feeling a little bit better than when they came in. And that's irrespective of how ill they are. The way in which this occurs is very often just through the very act of listening to the patient properly, actively listening to them. Another part of the consultation involves physically examining them. So even when someone has something quite minor, and you might think, well, I don't need to examine you to know this, I can see it. But the physical act of examining them, of taking them very seriously, and then the reassurance that gives them can be an incredibly powerful placebo effect, and they can often feel like their symptoms have completely dissipated by the end of the consultation. Another important thing to bring up is the role of stress. So stress makes most people feel worse, especially if it's too much stress, meaning a degree of stress in life is good. But when people have physical or psychological illness, anything that can be done to reduce stress, including a placebo treatment, which again includes talking, includes medications, it may include some kind of massage therapy, can actually lower the stress hormones and improve the way in which a person feels regarding that disease, and actually improve the disease in many cases. If we went to what we know scientifically about the placebo effect, they are discovering molecules that seem to be producing the effect, and there's even talk that one day soon it'll be possible to prescribe the placebo in a pill form, which I think kind of defeats the object of what we're trying to do. On imaging studies, so when we do things like brain MRIs and stuff, it's actually been shown that parts of the brain highlight or light up when a placebo is given, in particular things like the pain the areas that are responsible for pain perception. We're actually seeing physiological changes in the brain when a person is given a placebo treatment. So why don't we use it more often? Well, there are some ethical issues in telling people that they're getting something without telling them what it is that they're getting. So the question is, are we lying to our patients? And there's actually a very interesting study done in the last 10 years in Harvard, which showed that they took a group of about 80 people and they divided it in two. And they actually showed that people with irritable bowel syndrome, even though they told them that the medication that they were going to give them was a placebo, meaning it doesn't have an active effect, had a significant effect on their irritable bowel syndrome compared to the group which they gave no treatment to. So even when we tell people straight out that they're not getting anything of value in terms of a physiological effect, can still work. So it just leaves us down to, how do we tell people that it's a placebo? And this is probably a question that's ongoing, and I think it's a very personal question because each patient is different, and these are the kind of conversations that we just need to keep having. I hope you enjoyed today's video, and please click below on the like section if you see anything specific that you want to hear more about, make a comment, and look forward to seeing you next time.